So good morning, everybody, and thank you so much for joining us. I am very pleased and honored to introduce our speaker today, Dr. Laura Grubb. I first met Dr. Grubb at the University of Texas Health Science Center in Houston, where she completed her fellowship in adolescent medicine at what is now known as the McGovern Medical School. Before she was a fellow, she had received her bachelor's in science from Georgetown University, her MD from George Washington University, and then completed her residency in general pediatrics at the Naval Medical Center in San Diego. She served 7 years in the Navy as a pediatrician and general medical officer. And in 2002 and 2003, she was actually deployed in support of Operation Enduring Freedom and Operation Iraqi Freedom. She earned 2 Navy Commendation Medals and a Navy Achievement Medal during that time. She served as faculty at Baylor College of Medicine in Houston before joining us at UT. And during her fellowship, she published her first article in the New England Journal of Medicine entitled Lessons from Vermont's Healthcare Reform, and also obtained her master's in public health from the University of Texas School of Public Health there. After fellowship, she moved on to Tufts University School of Medicine, where she was the director of the adolescent medicine department. And while she was there, she taught and researched the impact of a sexuality education course for intellectually impaired students at a public high school that was close to Tufts. From 2016 to 2022, she served on the American Academy of Pediatrics Committee on Adolescents, which monitors and makes policy recommendations to the board of directors on issues surrounding vital adolescent health issues. She develops and authors policy statements, clinical reports, and technical reports on behalf of the AAP. She was the advocacy chair as well for the Society of Adolescent Health and Medicine for the past 4 years, just stepping down about a month ago, and continues to work with them. She's presented numerous posters, research presentations, and workshops at national meetings. And in 2020 was invited to join the editorial board for the Journal of Adolescent Health. Additionally, Dr. Grubb volunteers for the Boston American Red Cross Food Pantry and is an on-call physician for Amigos de las Americas, of which she is now the medical director. Just this past summer, in August, she moved on over to Boston Children's Hospital, where she is an attending physician in adolescent medicine there. I have truly been in awe and inspired by all of the important work that Dr. Grubb has done since our days together at UT, and I'm absolutely thrilled that she has agreed to speak with us today. So with no further ado, I'll hand it over to Dr. Grubb, and just wanted to let you know, if anybody has any questions during the presentation, please put it in the chat and I'll help to monitor that.
Wow, thank you. I'm sort of emotional. That was so kind of you. So I appreciate it. My origin story was Laura Benjamin's was one of my faculty while I was a fellow, and very early on I knew that my thing was advocacy and policy work, and I was actually told, not by Dr. Benjamin's, but very quickly that was probably not a viable academic pathway, that I needed to look at epidemiology or statistics, and that was not going to work for me. So thankfully, the good people of UT were able to really work with me to develop an unusual path during my fellowship, and which has now become my career. So, and I love it. So if you know of anyone that is, wanting to do advocacy or policy work as part of their academic career and they don't know how to do it, you can put them in touch with me, because it's been a path. So that being said, I was asked to speak today on adolescent policy updates, which is like, okay, that's really, really broad. So what are we going to do? So I kind of threw it into a couple of different things, and I really just made a couple of learning objectives. One is just learning about the policy priorities that are impacting children, adolescents, young adults, and some recent advocacy actions. And then talking about ways to be an effective advocate, because it really is something that every single person can do. And pediatricians and physicians, advanced practice providers, we're all in the perfect position to do this sort of work. And then how do you build an advocacy toolbox with resources? So this is going to be kind of a quick overview of all these things, and we'll do our best. this is advocacy right now. It is, in my mind, it every day it's been a fire hose to the face. And this is not an exhaustive list of things that come up. When I first became chair for the Society for Adolescent Health and Medicine, it was kind of a quiet, one of the busier committees, but not, no urgency. We just kind of got things done and we collaborated. And then the pandemic happened, and then also every single state decided that it was going to pass laws that would be really challenging for adolescents and their families. And so it just became this constant kind of urgency with a lot of need for reactivity. And honestly, it can be quite overwhelming. I mean, we just, it's hard to respond to 50 states plus however many territories. So, but this is what it feels like a lot of the day. So we can't cover it all. I'm going to see if I can do my best to get my links to work. And I might have to stop this part of the share. What do you see right now? Just the PowerPoint? Okay.
Yes.
So let me try to reshare again. And I want to show just a couple of nice resources. One is for the pediatricians, if you're in the AAP, I think the AAP does a phenomenally good job of talking about advocacy and giving you opportunities to actually engage. So you can click on the learn more. You can read about the different topics that they have. They have these nice fact sheets you can use for any sort of advocacy efforts. And so just even starting with something that most people here are probably actually paying dues. And so looking here, and then they have the state level things, and then you can actually log in. You can actually become, you get on the advocacy mailing list, and they'll mail you every time there's a hot topic and they want people to sign on to things. You can go right there and you can sign on. So, and these are just a bunch of other things. So the point of this is just to say, like I said, I can't do an exhaustive list of every, all right, let's see, did I do that right? Oh, bear with me. All right. So again, since we can't cover it all today, this is a good way that if you're excited about this topic, you can go right there. I think you can share my slides with people. I have no problem with that. And then if you actually go to the main, that page as well, there's a long advocacy report from the AAP. It is beautiful. In just a few sentences, they sum up the issues, reproductive health, food insecurity, housing, Affordable Care Act, et cetera. So each of those sections is really well done. I just picked 3 hot topics in adolescent medicine, and by all means, there are so many topics that are equally important, but these are the ones that people are talking about. We're talking about gender affirming care and transgender rights, reproductive and sexual health care, and then gun violence. So I'm just going to do a quick overview on these topics and some of the things that are in the work. At any point in time, certainly, post questions or ask. I don't mind. This is meant to be as interactive as we can. This is the big one, and you're seeing this is just it's everywhere and it's everything, and it's really challenging for families. Even in my home state, there's been this big movement. My home state is Texas, to kind of take away all care for these individuals and to target their families. So this is just a number, like this is the a little bit of an estimate of how many transgender youth there are in the US. And sometimes I think what I wanted to do is make sure I got down to like the state level. So if you look here on Michigan, which is the state that you guys are in, there's kind of an estimate of about anywhere from 64 to 8,900 trans youth. And that may not seem like a huge part of the population, but those are human beings, right? Each one of them matters individually. So, these sorts of legislations can have a dramatic impact. This is a busy slide, but since 2020, so only in the last two to 3 years, 36 states have introduced legislation to impact the gender affirming care for minors. And 9 states have already passed laws that ban such care just completely. And then really interesting, in Florida, there's a new executive order, which for providers that provide gender affirming care, they actually can be reported to the medical board and for licensing and sanctions. So, really threatening on the provider level their professional career. And then Texas has executed this mandated reporting that if families or providers engage in gender affirming care for minors, that the providers can be reported, the families can be reported to family services. So it's really scary for these families. And then you've got 19 other states that have also introduced more bills that would further restrict. And then 13 states have, are looking to make it a crime for medical providers to provide the care. And then, like in Florida, they're also they're barring. But Florida's always on the tip of these things. But Florida and 6 other states have barred coverage by Medicaid. And then, some of the states are pushing those bans up to 26, which is so interesting. I always feel like someone's an adult when we want to hold them responsible for something, and they're also an adult when, but they're not an adult when we don't want to hold them responsible. It's like the law, it kind of makes you an adult when they want to punish you. And then Kansas, Oklahoma, and South Carolina have got these bans up to 21. And the Nebraska bill, it's interesting because in Nebraska, the age of being a legal adult is 19. So this bill would extend up to 18 because at the age of 18 in Nebraska, you're still a minor. So this is just a flavor of what's happening on this particular topic. And then, this is what it looks like when you start taking care away from people. You've got almost 150,000 youth that are losing access to care, gender affirming care. And then, you've got almost 80,000 that are in those states that have banned it. And then there's another probably 6,700 people, 67,000 that are at risk for losing care. So it all adds up. I mean, these are all humans. So, and if you look at the national landscape, this is transgender youth by state, kind of a concentration. So I threw Michigan in here. It's about 1.4% of the state population, which is about 8,900 individuals. So, it's a good number. And then if you look at the Michigan data, for trans or non-binary individuals, again, we have the 8,900. And then in adolescent healthcare, which is, we do often go up to ages 25 to 26, there's about another 11,000 people. Yeah, Elizabeth, that's a great point. They're banning up to 26 because the CDC defines youth as up to age 25. And it's very interesting. Then you take rights from adults, right? So I don't know if you're aware, but Michigan actually in March of this year introduced a bill that by Steve Cara, I believe is his name, that if you can knowingly or intentionally cause physical harm or serious mental harm to a child, if you knowingly or intentionally consent to obtain or assist with gender transition procedure for a child. And so really this can actually impact the parents, the providers, other people that might be engaged in facilitating that sort of care. It was intentionally written as a very vague bill so that it would kind of catch in the net as many people as it could. And I don't know, I mean, it was only introduced about a month ago. I don't know if anyone here in the state of Michigan that has any knowledge of, you know, I mean, I think it's unlikely this bill would ever get signed into law with the current governmental structure in Michigan. But does anyone have any experience with this bill?
I haven't seen any updates to it, but I agree. I think it's unlikely to be passed in our current legislation.
Yeah, yeah. So, and then for reproductive and sexual health, like I said, I'm doing quick bullet points on the hot topics. So, the biggest one I think we talk about right now is abortion access. And this map is super helpful, I think, to just I like to look at geography here. What states have in the last year expanded access, which is these blue states, which is protected, which is just there's no protections, there's nothing specific. Which ones are hostile, meaning they've passed more strict laws, and then where is it outright illegal? So my state of Massachusetts, we've got protected rights. Those were signed into law a couple years ago, actually. As you know, Michigan just did a bunch of protections, and then my home state of Texas, and Laura's once home, has made it illegal past 6 weeks, in kind of a vigilante sort of justice way, where you report somebody. So it's really creative and challenging. I think if you're not familiar with Guttmacher, and so I'm gonna see if I can stop the share and do this slide. Bear with me. But Guttmacher has some really amazing updates on the legislation. And so, let me see. Yeah, nope. Yeah. So they update this constantly on reproductive health, and not just abortion, but other types of access as well. So they do have all the topics you can do a drop down on, and they're constantly tracking these things. So I think it's interesting to see, this is so exhaustive the way they've looked at this, which states have, banned or introduced or enacted, introduced or enacted legislation to ban abortion, and you can see, then they go into specific caveats, like are any states, proposing to ban abortion based on a genetic anomaly, or for race selection, like that's happening in one state, sex selection. So these are really specific things. All or most abortions are banned. So, and there's been 54 different pieces of legislation passed recently, introduced. And then if you look, there's the fetal personhood laws, criminalization of women or individuals with uteruses, and then, it goes on and on. Like this page you could scroll for a long time. So I don't want to bore you with it, but I think it's really important, if you get excited about these topics like I do, you can go use that as a resource. And then these are things that just happened recently, but Kansas just voted to protect abortion access. That was a referendum for the state. Governor Whitmer has assigned a law to protect abortion access. That just happened not even a month ago, I believe. And then the Wisconsin election was pretty decisive about, it really was, for the state Supreme Court judge was very much hinged on this topic. And then the last week or the week before, the Texas, one of the federal judges ruled the FDA mifepristone was approved illegal. That was just stayed by the Supreme Court. I think the Supreme Court's actually going to hear that today. And there is credible to reason that they may actually issue a decision today or tomorrow. I don't know, they love to do these things on Friday. So maybe, maybe it won't be right now. So, okay. And then you even just look at contraception, which used to not be that controversial, right? Like it was, and then it wasn't. You know, and if you just look at adolescents, about 66% of them use contraception, and they often use it for medical purposes, not just for pregnancy prevention. You know, we've got 37 states that require parental consent for abortion, and then, but you look at the average age of most states, it's 18. So we've got things kind of all a mishmash. You know, Title 10, so that's huge. That was a law that was signed in, a federal law by Nixon, to give reproductive health care access specifically for contraception. And it specifically said that minors could consent and have confidentiality if they receive services through Title 10. In December of 2022, a Texas judge has negated that. So that's going to work its way all the way up to the Supreme Court. And we're going to find out. That's probably one of the most consequential reproductive health laws that we had is Title 10, and it's been in law for more than 50 years. And then this one's really interesting, but for pre or post exposure prophylaxis against HIV, you know, now that a Texas judge has ruled that the government cannot mandate coverage. And, you know, this is really deep rooted on some bias that, you know, people that are at risk for HIV must in some way have a moral flaw, or maybe they're gay or they're trans, and that's why they need this treatment. I mean, you know, this is used for many, many people, and it's also really important for people that have been raped, that, you know, we use post-exposure prophylaxis. This is a very expensive medication. Laura probably knows the numbers on the meds. But it's quite expensive. But in the long run, it saves a lot of money if someone doesn't get HIV, right? So, okay. Any questions so far? And it's like, here's the hard part about adolescent advocacy is it just feels like a doom and gloom lecture. So I'm happy to take any questions. Hopefully I'll leave you with some hope and some optimism. I'm gonna try.
Well, Laura, if I understand correctly, this ruling by the federal judge in Texas may not only impact PrEP, but may impact other services covered by the Affordable Care Act that are deemed to be preventative.
Yep.
So it may have far-reaching impacts beyond and above just being able to provide these medications. It may impact other preventative services, mammograms, colorectal screening, all of that.
Yeah, I mean, the Affordable Care Act is under assault in the sense that, like, you know, when you go in for a routine physical and you get, you know, the appropriate screening labs, maybe a pap smear to go with it, or, you know, PSA or whatever, you know, it's not saying you can't, this ruling has said you can't mandate, you know, like essential preventive care. So yeah, it could have huge implications for the whole system. So, so Elizabeth, great question. If PEP isn't covered, is the post-rape treatment for gonorrhea and chlamydia covered? Well, here's the thing. We're starting to create this climate where anyone can object to anything. And so if employers object to it, or the health insurance companies object to it, or the state legislation of publicly funded care, like all of it could be impacted, like all of it. So, and Ravi, I see you have your hand up. No, maybe you're just waving.
You're on mute if you have a question, Dr. Ravi.
Feel free if you
Yeah. Okay.
There you
I got it. So, yeah, a little bit technologically challenged. Since the parents are paying the bills, they will come to know, regardless of what type of confidentiality you practice in the clinic setting. It's not like you can keep it away from them. They are paying the bill for the medication, procedures, whatever. So how do you maintain, is it even possible to maintain confidentiality from the parents?
Dr. Ravi, I have an entire 1-hour lecture on that topic. I will say it is state dependent. So under certain funding streams like Title X, Medicaid, usually the foster care system as well, the confidentiality is protected, even if they're an adult in those systems. And then, sorry, you're right, though, I'm deviating. It really depends on the state. It's statewide, so it really has to do with the reporting by the insurance company. So like both, I know Massachusetts where I live and then Rhode Island actually has specific laws that says if someone is an insurance beneficiary who's 18 or older, they still have the legal right to confidential care and protection. And so these are the steps that must be done to maintain their confidentiality. And I can speak to the exact steps that can be done in Massachusetts. I don't have an answer from Michigan. That is an answer I could get you pretty quickly after I finish this talk, and because it is state specific. But I could help with that in a little bit. But that's a great question, and parents often want to know information if someone is on their insurance plan, and but there's 50 states plus X number of territories are deciding how they're going to do that.
But for the most part, hi, this is Dr. Marshall. But for the most part, patients with Medicaid, there is no billing that goes home to their families.
Right.
So those families don't get an itemized, explanation of benefits about procedures, labs, and diagnosis. So it's our families that have commercial insurance that parents will get that information, and that is hard to keep confidential.
Yeah.
So if there is a copay situation, the parents would know. If there's no copay situation, they may not know at all what's going on with their children. Is that the situation?
Yeah, that may be. Like I said, it's state dependent. So I can only speak extensively on 2 states, Texas and Massachusetts. If they're 18 or older, definitely most states have developed a mechanism for that confidentiality because they're a legal adult. But under 18 it's much more complicated. I'm happy, like if you want to have me back, that's a whole topic I can go through, and Laura and I could even do it together since she probably knows Michigan. I'm going to move through, but I'll take more questions, and I will definitely get more information to you about Michigan because I'm curious now. All right, see, again, it's really sad. Like we just keep going through one sad topic after another. The other one that's a hot topic, just so big right now, is gun violence, right? And so, and it's really interesting looking at this, the cluster of how these things work. A lot of it's coastal areas. There are actually a lot of guns in rural places, like Wyoming, Montana, and Maine, but yet they actually report less, gun violence compared to some of these other places. And this is actually really challenging. This is the 7 years in review. And if you look at particularly, you can look at children and teens killed or injured, and the numbers have just gone up and up, right? So that's the sad part is this isn't, I always find it amazing. We have like a public health emergency when kids are vaping and like 2 people in the whole country die, and so we're going to ban vapes in certain states. But yet, we've got so much gun violence, and we seem to be in a state of paralysis right now. So it is a big public health issue. And then if you look a little bit further here, you can see that this is for 2023 only. These are the number of gun violence deaths that we had as of 1 week ago when I finished preparing this presentation. And then if you look at teenagers, there's, I'm sure, more than 1,400, at this point in time, and then children alone too. So really a lot of, for one short period. And we've only gotten, not even a quarter way through the year. So, well, we are a quarter way, a third. And then if you look specifically at children, about 12 children a day die from gun violence in the US, and then about another 32 are shot and injured. And about 4.6 million children live in a home where one gun is kept loaded and unlocked, right? Which is statistically terrifying to me. There is safe way. I was in the military. Most of our families had guns, but there is a safe way to have a gun. And then if you look at for American children and teens right now, guns are the leading cause of death. It surpassed car accidents. And then, and 5 times higher than drownings. And then, Columbine was sentinel. I remember when that happened. And now it's sort of a every other month experience, unfortunately. And we've had more than 338,000 students in the US that have experienced gun violence since then. And then in 2022, there were 46 school shootings. So 46, there were more school shootings, 46 than in the year since Columbine. I'm so sorry. And when they say school shootings, that's not an actual shooting. That's the number of people injured on that one. And the gun violence has these deep inequities too, which populations it affects. Particularly high, and you don't often see statistically on things, as Native American and Alaska Natives, because they're not a large portion of the population. But if you look at the statistics within their communities, it's really disproportionate. The same thing in individuals of color, often at much higher risk for gun violence. It's the leading cause of death for Black males under the age of 25 is homicide. And the vast majority does involve guns. The common sense gun legislation. Yep. Oh, I love all these resources. Thank you, Dr. Benjamin. These are awesome. Like I said, so it's a lot of doom and gloom, unfortunately. Since 2018, there's been 158 school shootings. At least one person was killed or injured. As of last week, we had 2023. We had 14 individuals injured. So that is really, really heavy. And so what I like to do is pivot and give you a little bit of hope that there are people out there on the front lines fighting, and then let you know how you can get involved. So the AAP is almost 70,000 pediatricians, and they just do such beautiful work. And they've actually come up with we did get the Bipartisan Safer Community Act, which actually was one of the first comprehensive federal gun laws that we've had in a long, long time. So I think this is, has the potential to be very helpful. It, it's going to support these risk protection orders, look more at firearm trafficking, and then strengthen background checks for buyers under 21. And then also the AAP, championed the Pediatric Mental Health Care Access Program. And so that's going to allow more access and funding streams in communities for mental health. And then we've got more direct funding. So I'm trying to tell you about some wins, because we need some wins. And then, we've got some other things that have been really helpful. The 988 universal number. So that's the suicide, crisis number that, you don't have to look up a long 1-800 number. You just dial 988. It's on most of the bus stops around here, which I get excited about. And then state and local governments are going to start to build these mental crisis response programs. We have a really good program here in the Massachusetts area where I live. It's called the BEST team. If someone's having a mental health crisis at school or home or work, and it doesn't necessarily need a law enforcement response, they can call the BEST team, and the BEST team will come and respond. Often they can address people in a trauma-informed manner that can de-escalate things and keep everyone safe. So this will start to be happening through some of this legislation. And then we also have the Inflation Reduction Act. So this actually has huge investment to address climate change, and it's designed to decrease greenhouse gas emissions by 40% by 2030, which isn't so far away, right? So those are some wins. Some other wins that I think have been really helpful. You know, the Baby Formula Act. I mean, we think about things, but then you have a pandemic, and then you have a contamination of baby formula, and then all of a sudden you've got this shortage, and people can't feed their children. And WIC is a great program, but it often can be cumbersome for if the formula you want and need is not available, you've got to go get a prior authorization. So they actually did these waivers through the end of, this was through the end of 2022. And then also some waivers to increase the way that we provide nutrition in school. And then there was a big conference on hunger and nutrition and health at the White House in September, which was the first time this sort of conference had been held in more than 30 years. You know, and they really looked at a national strategy to end hunger and reduce disparities in diet-related diseases. And then if you're not familiar with the public health charge, that was really, really consequential. So in the previous administration, there was an executive order basically that said, if an individual is in this country, if they're not a US citizen, if they want access to service like SNAP or Medicaid or WIC or stuff like that, even though they may be lawfully in this country, if they apply for those things, we will take that into consideration for things like green cards. And so, you know, if you're using public services, that would be an adverse metric for your green card. And so what you saw was a lot of people starting to forego these services, even though they were actually legally entitled to the services, because they were so concerned about their immigration status. But then, you know, I mean, WIC feeds children and infants, right? So you're looking at, you know, often pushing marginalized communities further into the margins. Fortunately, this has recently been abandoned. So, so individuals who are legally in this country that have a right to these services aren't going to find that their long-term legal status is in jeopardy. So. And then, of course, just some local things, because I worked really hard on this with this organization for the last 4 years. So, you know, a lot of the states that have enacted laws against gender affirming care or abortion restrictions, or even, you know, trying to sort out if adolescents can actually, minor adolescents can consent for just vaccines. So the Society for Adolescent Health and Medicine, along with the AAP, have filed amicus briefs with different organizations that are, so we're not actually suing them, but the individuals that are part of the litigation, you know, against these sort of actions we've signed on to. So it's kind of a show of strength a little bit, using our voice. And then SAM issues some statements, which I think can be really helpful. The reach of SAM is not huge, but it's always helpful if you have something at your fingertips. So, you know, when, so they initially, when Mississippi versus Jackson Women's Health, which was the Roe versus Wade reversal, basically, there were a couple of statements that we wrote when it was first a leaked draft, and then further as an actual a final decision from the Supreme Court. You know, and I think these positions were unique because they really talked about how these laws uniquely impact adolescents. And then, you know, we have put out responses to the mass shootings. And then recently we did actually provide written comments to the FDA on the over-the-counter status for oral contraceptives, which that hearing was supposed to be in November and it got postponed, and it's now occurring in May. So if anybody's interested in submitting comments to the FDA, I can give you the links on that. And then, you know, the AAP put out 2 different reports that I think were really helpful at this time. One was about pregnancy options, and then the other one is about suicide in adolescents. And, you know, I was part of the committee that gave feedback on those reports, and those reports actually are now published. So, and then, you know, the Society for Adolescent Health and Medicine also has signed on to many things. I can give you that list, but also very excited. We just signed on for gun violence prevention. You know, for years and years and years, we didn't do any public funding into the research of gun violence. And that has changed in the last about 4 or 5 years. And so now we're really looking at how do we, you know, create a sustainable, robust funding stream for that important research. So, all right. So this is the final part. This is where I get really excited because I talk about how do you do things, right? So advocacy is an action that speaks in favor, recommends, argues for a cause, supports, defends, or pleads on behalf of others. And you know, in healthcare medicine, we have lots and lots of advocacy opportunities. Sometimes it's just the care that we're providing to a patient in that moment. Or, you know, as an adolescent person, I'm often advocating for my patient, you know, with their parents, trying to get everyone on the same page, right? So how do you advocate? Well, I have learned step number 1 is fill your own cup, okay? I love this, but I also find that it can take a lot of emotional energy. So you don't have to jump out there if you've got other things happening that take up your energy or you need to put even into self-care. But if you are going to do advocacy, do what you're passionate about. You know, I will, you know, on behalf of organizations, I'll pursue something, but I know it's when I feel like it's something I really care about and believe in is when I do my best work, right? Recognize and leverage your expertise. I think for healthcare providers, we are in such amazing position because we're talking with policymakers and often on the state or federal level. We have so much expertise that we can provide. And I know when I've worked on behalf of SAM or the AAP and gone and met with the staff of legislators in DC, like we are always treated well. We are not slimy. We are not, we're not the tobacco lobby. Like we're there fighting for children. And so they always bring us in with open arms and they're always really excited and they're excited to ask questions because we know things they don't. And they're hearing about them in the news and they're curious. And we also have this unique ability to tell stories. And I think being a storyteller is a great advocacy tool that you can say like, well, let me tell you a story about a family I saw recently, or let me tell you, you know, what human trafficking looks like in real life, you know. And so I think those are the ways that you have these tools inside of you. You don't have to do a lot to build it. You want to use methods that suit your strength. I'm a writer. I love writing. You know, I am not into meetings or retreats. You know, I don't love working on teams. That's me. So, you know, if I am on a team, it's a small team. So some people love being in media. You know, they're going to do TV interviews. They're going to do print and radio interviews. I don't want to be on a camera. So, you know, so everybody can do this in their own way, whatever works to your strength. Collaborate and share. So there are often other people that are passionate. And there's also, you know, a lot of work that's already been done. So you don't have to reinvent the wheel and you can amplify your voice. You know, I'm one person. The Society for Adolescent Health and Medicine is only about 900 people, but we collaborate with the AAP, which gives us a 70,000 person megaphone. So, so that's how you do it. You take, you know, even if you're one person, you know, find your people, do what you love, and amplify things. You know, what are the current opportunities? Well, this is like not an exhaustive list, but I would actually like to, I think we've got a minute or two. We do. I would love to hear from just a couple of people in the audience. You know, either you can put it in chat or you can say it verbally, like, don't even look at the list, okay? Just tell me a way in which you think you've advocated before. What kind of advocacy work have you done? And it can be so many things.
So we have a lot of learners that come through our clinic, medical students. We have residents from St. John, and I think just educating them on some of the current issues, how it can impact the care that we deliver, especially to teenagers. Since I'm an adolescent physician, I focus a lot on that. So I feel most of my advocacy has just been through the education of our learners.
Yeah, education. Isn't that great? Education is advocacy. Yeah. Another example of an advocacy work somebody might have done?
I don't know. I'm not good at writing a long letter to legislature, state or national level, but Sam recently had an initiative because they're considering changing the status of having a adolescent certified, board certified faculty member in order to have an adolescent medicine program. And so they put out, a letter, form letter, you could add email comments and send it off to I think it's the AAMC looking at this, or there's the Board of Pediatrics looking at this change. So trying to join other organizations, especially if there's a letter writing campaign about something I feel really passionate about.
Yeah, that's a great example. And that's a great example of amplification. Sarah Pitts found out about this. She put it on the listserv. And then from the listserv, a lot of really good ideas came together. People contributed. And then someone, was like, here's the link, go make comments. And, it ripples out, right? Like, not everybody's in SAM, but somebody might have a friend, that's not in SAM, and they send it to them. And so, yeah, awesome example. Other examples of advocacy. Okay. So I'll we touched on this list already, but like just things like public education, right? Like educating the community even, and sometimes people get on TV to do that, or they might write something. You can educate voters on issues, right? I have the little voter registration, a QRS code on my the Vote ER badge you can get. So anyone that's 17 or older can scan my badge, and actually it takes them right to the link where they can register to vote. So, going to conferences, we get together, we talk, we get excited, we motivate each other. There's advocacy training. So both the AAP and SAM offer this. You can go directly talk to legislators and inform them on issues. You really do know this issue better than them when it comes to public health and medicine. So it's an easier than you think it is. And then, just even educating people about the legislative process, research or, organizing so people can build. You may go to a rally, you might, mobilizing for a cause. You may look at regulatory agencies. Like I said, we're sending in comments to the FDA, encouraging people to vote. Litigation, which on the individual level is going to be hard for us, but we can support our organizations that often do engage in that kind of work, and then lobbying as well. So those are if you there's practically any way to do this work, which is the best part. And it just makes sure that everybody in society is able to have their voice heard on issues that are important to them, protect and promote their rights, have their views and wishes genuinely considered when decisions are being made about their lives. And it really aligns with our mission as healthcare, and definitely as pediatrics, because we have a huge population that cannot vote. So it cannot speak for itself. So we have to speak for them. The AAP, like I showed you, their action center, they've got this way to become an advocate. And then they actually have their annual conference every spring. They just had it in March, but if you haven't done that, that one's great. When I was a fellow, I actually was able to get, the AAP offers travel scholarships. So I got a travel scholarship. I went there. I think it starts on a Sunday, and you meet and they educate you all day about the process. ways that you can do advocacy work. And then they'll educate you on the 1 or 2 topics they want you to take to the Hill. And then the next day you get up and you go with your little state group, and they've made appointments with the staff of your representatives. And so, you'll go talk to the 2 senators' offices and your congressional person's office about the 1 or 2 issues, the AAP. And sometimes it's the first time you've ever done it, and it can be a little nerve-wracking, like, oh, I'm going to go talk to my senator's office. But then it's overwhelmingly positive, because again, it's really hard for people to your face, like really, kick children. So they're usually pretty nice and receptive and willing to learn. This is one of my favorite things, which is anyone that's a medical student, resident, or fellow can actually do the AAP Federal Affairs internship, which is in DC, and you spend 4 weeks there. I did that as a fellow. It hadn't been done before, so I wrote a curriculum and was able to get ACGME credit for the elective, and actually got my practicum credit for my MPH at the same time. It was great opportunity. So it's a well-kept secret. So if you have any learners that are excited, show them, because it's a year-round program too. So that doesn't have to be like one particular month. And I see someone put in the chat that they've done some work around childhood cancer-related issues locally and worldwide. Absolutely, Robbie. So you can do things locally, you can do things, internationally. And then for the SAM, I know them well, but they do a lot of good advocacy work. You don't have to be a member of SAM to go to the website and access, a lot of the statements and resources. But they've got a bunch of different mechanisms, and I always tell people, if there's something you want, just ask someone, because there's someone always willing to do it in some capacity. And then if you're not familiar, the Michigan AAP has a chapter, and each chapter has an executive directive, which is a paid employee. And their full-time job is to serve the constituents of the Michigan AAP. And they are an incredible resource. The one in Massachusetts, I can email her, and within half a day, she sent me a response to my question. We have a thing called RDASH, which is RF-, Resident and Fellows Day at the State House, that happens once a year. It's organized through our AAP chapter. I did not see such a thing on the Michigan one, but this is an advocacy opportunity if somebody's motivated to go back to the Michigan AAP. But it's so the state chapter organizes a day for the fellows and the residents. They go up to the State House, they wear their white coats, they get a tour, and they meet with their individual state representatives on the 1 or 2 issues that the local chapter of the AAP has determined important. It's a really fun bonding experience for the residents and fellows. So again, I didn't see it for Michigan, but it doesn't mean somebody in the state and this audience can't get excited and ask for it. So, I think the American Public Health Association has some great resources, and so does the American Academy of Family Physicians. And then Physicians for Reproductive Health, the Advocacy Committee of the North American Society of Pediatric and Adolescent Gynecology. And then there's a nice organization called Advocates for Youth. And then other things you can drill down into is, does your hospital have a legislative affairs office? Like, some hospitals have one person. Boston Children's has like an entire team, and like, I can just dial them up and they know every single thing that's happening in the state legislature. Like, their finger is right on that pulse. So find out if your hospital has something, because that might be a good way to get participation, like to participate without having to reinvent the wheel and do a lot of effort. And they love having providers, jump on. That's a good megaphone for them. You can ask the executive director of the Michigan chapter of the AAP to come speak at your hospital or your program. You can ask the AAP state legislative staff to speak. They are so open and willing. So if that's an option, I can connect you with the individuals in the state office, state legislative affairs office, which is in the Chicago area, or do a Google search. I find so much through Google. Look for a not-for-profit that's advocating for your concerns, because pretty much they would love to have your help. So that's it. I know that was a little all over the place, but it was a wide ask. So So I don't know why the US cannot get it together with abortion, Ravi. It's really complicated. Good question in the chat. So I'm happy to open this up and answer any questions or what are the most immediate repercussions you're seeing and what do you expect in the future? I mean, I think what you're seeing, so this is in the chat about gender affirming care. I mean, I think what you're seeing is it's becoming restricted in so many states and areas, and families are, you know, in one state, Tennessee, they actually not only does the law say that it's illegal, but you have X amount of time to detransition kids. So, I mean, that is a really different concept, right? To detransition somebody. So, I think you're going to look at, some families are not going to be able to do what other families do. Some people leave the state. They might even move permanently to another state, or they may get their care in another state. This is going to disproportionately impact families that rely on public insurance or don't have the means or the resources to leave the state for care or go to or have their family relocate. So there's going to be a broadening of inequities. And so you're going to take two marginalized communities, which are people that lack, socioeconomic resources, and trans individuals, and like further marginalize them. I mean, it's going to get to the Supreme Court. Everything does eventually these days, and we'll see what they do with that, right? As we know, trans and LGBTQ youth are the highest risk for suicide among all youth. So is it going to further deepen the mental health situation and increase the risk of or increase the actual number of suicides? Very possible. I don't have a magic ball, but man, there's a lot of implications there.
Well, Laura, I don't know if you remember Dr. Feldman, Jen Feldman in Houston. So she worked at a fairly qualified healthcare clinic in Houston and had a gender affirming care clinic. And we had actually asked her to speak to us about that topic, and she said that she can't even talk about it. So there's, I think, so much fear, even just in terms of what you can and can't say, not only to your patients, but even publicly, fear of losing your license, having criminal persecution is a whole new world. And I think it's really scary for us physicians not being able to provide evidence-based care that we know is good for our patients. It's really kind of a scary place right now.
It is. I mean, and we don't know where it's going to go, but it's scary, and it's also, it's going to marginalize a lot of populations, and it does. You can look at what happened at Texas Children's when Catherine Gordon came. She was the first woman, actually president or chief of the hospital. There in pediatric hospitals across the country, there's just very few women chiefs. I think there's like less than a dozen. And, she was only in the role for about 6 months when this gender affirming thing came through. She spoke out, she published in the journal Pediatrics, and then subsequently she stepped down from her role. So we lost a woman in positions that aren't frequently in positions in a specialty that mostly is comprised of women. So yeah, I mean, it has all these ripple effects. Ravi, do you have another question?
So I was going to ask you with regard to this gender affirming care, how is it addressed for children born with disorders of sexual development, particularly, let us say, I take care of a patient with 46XY sex reversal that has a very unique red cell problem. So that's how I'm a hematologist, and that's how I got involved in that. So how is that addressed for these persons are there exceptions for those cases, or no?
I don't think so, because if you have to, first of all, the people that write these policies, almost none of them have any medical background or training, and nothing is scientifically based. If you look at the legislation that's going to be introduced in in Michigan, what has been introduced in Michigan, I mean, it's like a 5-sentence legislation. Like, I mean, it's longer than that, but these things are intentionally vague because they want to have as few waivers as possible, but they don't. I haven't seen any legislation that talks about, these sort of conditions. So, yeah, that's the thing that's concerning, is these things can all be very slippery slopes. So I think it's going to be on a state by state, but it also depends what the actual language of the legislation says, and if there's any exceptions or not. So, yeah. And yeah. So I must go see patients on the Zoom.
Yep.
But I'm happy if there's any last minute questions or comments to take them. Thank you.
Thank you so much.
Thank you. Thanks very much.
Thank you.
Really
Thanks.
appreciate. We know that a lot of this is overwhelming, so thank you so much for giving us tips and ideas about how to be an advocate, and we so appreciate your time and all of your work.
Thank you. And please share my slides, because I intentionally put all the links in them so that people can use them. So it was nice meeting you guys, and thank you.